Is your dog at risk of kidney disease? Don't wait until it's too late. From lurking dangers in your backyard to the surprising link between tick fever and kidney damage, we've got the insights every pet owner needs. Learn how to shield your pup's kidneys, spot early warning signs, and ensure kidney-protected life. Hello and welcome to the Care Track channel. Today, we'll be discussing a crucial topic that affects our beloved pets: kidney disease in dogs. Unfortunately, it's one of the leading causes of premature death in dogs. Types of kidney disease in dogs. There are two main types of kidney disease in dogs. One is acute kidney injury, a condition that develops within a short period. Otherwise, there is chronic kidney disease. Otherwise, it develops over a long period, sometimes over years and months, that develop continuously. Now, if you take acute kidney injury, such conditions can be cured in some way. But if you take chronic kidney disease, it is often impossible to cure. Factors behind acute kidney injury. There are several factors that can cause an acute kidney injury. One is infection. We know that a general bacterial infection can go to the kidneys. Especially, an infection of the bladder can go to the kidneys through the ureter, and a condition called pyelonephritis in the kidneys can lead to a bacterial infection of the tissues of the kidneys. In addition, there are some infections that usually come through the blood. The condition called leptospirosis. If you take a condition like leptospirosis, it is also a bacterial infection. It can also enter the kidneys through the blood. There is a risk of kidney damage due to the toxins released by the bacteria. In addition, if we take some other poisons, it is said not to drink water from the pond in the garden. If you live in an industrialized area, there is a chance that the kidneys will be damaged after licking some of the chemicals in such places. The other is that some snakes have poisons that directly affect the kidneys after eating snakes. There is a possibility of damage to your dog's kidneys due to such poisons, and in addition to this, sometimes drugs and unqualified veterinarians vaccinate dogs. Then there is a possibility that the kidneys will be damaged in some way by the vaccine given for some diseases. Now, the main thing I am raising in this discussion is that if there are such risky situations, it is very important to keep your dog away from such things. Chronic kidney disease. Then the other thing I mentioned is that chronic kidney disease or chronic kidney disease that has developed over many years, especially the factors that affect such diseases, there is a possibility to change. One of the main ones is that with age, tissue damage can occur. It is known that aging is a decrease in the function of the body's tissues, and it has the kidneys as a major organ. The cells in the kidneys and the cells that make up the tissue may become inactive. The function of those cells may decrease. Because of this, complications may occur in the kidneys. The other thing is that there is a possibility that the kidneys may be damaged by the parts of the immune system. These are the obvious causes of kidney failure. Then if your pet is protected from these reasons, there is some possibility to ensure kidney protection. For example, one thing I neglected to mention at first is that it has been recently confirmed that tick fever can damage the kidneys even if it is present for a long time. Tick fever and other emerging risks. It has recently been confirmed that even if tick fever is present for a long time, it can damage the kidneys. Controlling parasites is important to protect your dog's kidneys. Then we know that dogs are injected with medicine to control birth. After vaccination, uterine complications can often arise. Such conditions also lead to some form of kidney damage. If you suspect a kidney disease or a urinary system-related disease, it is important to take the dog to a veterinarian as soon as possible and treat the dog. Sometimes it is a simple urinary infection, but if the simple urinary infection is not treated properly, it is a bacterial infection. The bacteria can go to the kidneys and destroy the tissues of the kidneys. Then if your dog is having difficulty urinating more often, or having pain during urination, maybe blood in the urine, or if the urine is changing color, that is, if it shows any symptoms related to urination, take it to a veterinarian as soon as possible. Treatment is important. Sometimes urinary stones are allowed to grow. If urinary stones remain for a long time and make it difficult to urinate, it can also cause some kind of damage to the kidneys. Seeking timely treatment. That is, you can prevent an acute kidney injury, but you cannot completely prevent a chronic kidney injury, but if you catch it early, you can somehow manage it well. Normally, we diagnose kidney disease by doing creatinine test. Or we do BUN test. Especially if we take a creatinine test, creatinine is usually 0.5 to 1 in a healthy dog, but after that, 2 or 3 times, sometimes it can go up to 20, but creatinine is some kind of level. It starts to increase and takes a significant kidney damage, especially tissue damage. That's why it is important to take your dog to a veterinarian and get some kind of treatment done when the basic symptoms are shown. In conclusion, understanding the causes and preventive measures for kidney diseases in dogs is crucial for responsible pet ownership. While acute kidney injury may be preventable through awareness and caution, chronic kidney disease requires early detection and management. Regular veterinary checkups, proper hydration, parasite control, and prompt treatment of symptoms are essential components of ensuring your dog's kidney health. If you found this information valuable, smash that like button, subscribe to CareTrack, and hit the notification bell.